COVID testing is becoming more and more important these days as people want to go back to a more normal lifestyle. We really just want things to be as they were. Kids want to go to school, people want to go to work, we want to go to the movie theater and restaurants, we want to have large family gatherings, Thanksgiving's coming up. But at the same time, we don't want half the people who go to those things to get sick. And so we want the best of both worlds. We want it to be like it used to be. So how do we do that? And the answer is we need widespread testing that is cheap, fast, and easy. And the good news is there's a lot of companies who are working on this, and there's going to be some tests coming out in the next couple months, and it's going to be really exciting. So I wanted to share this news with you. Before we delve into this, let me introduce myself. I'm Dr. Rachel Johns. I'm an internal medicine doctor specializing in hospital-based medicine in Southern California. My passion is educating patients on healthcare topics that matter so that you can live your best life. And as I said, there's a lot of information out there on COVID testing, and things are going to come up soon, and I want to keep you guys updated, so please subscribe to my channel so you don't miss any of this important information. So let's go over some of the kinds of tests that are out there, and just as a big overview. So there's two kinds of diagnostic tests. These are diagnosis tests, meaning am I sick right now with COVID? And those are molecular tests, which are looking for genetic material of the virus, and antigen tests, which are looking for the outside proteins that are on the surface of the virus. So if you've seen the picture of coronavirus, it's basically a white ball with these red thumbtacky little things that are on the outside of it. And so the antigen tests are looking for the red thumbtacky things on the surface. The molecular tests are looking for genetic material, RNA, that are inside the virus. The other kind of test category is an antibody test, and this is looking for your body's immune response to the virus. So your body detects something that is foreign, meaning this is not me, and what it does is it recruits troops. It's like an army. It recruits troops. You go to boot camp, you learn how to fight, and then you go into battle. And at the same time that you're going into battle, you're actually recruiting more troops at the same time. So these tests are testing, for these antibodies that is present in your system, but it takes time. So this is not a diagnosis test. This will tell you if you've been infected in the past. So if you were like super sick back in February and you want to know if that was coronavirus and if you're now maybe immune to it, you can go have an antibody test and it will tell you if you have antibodies in your system that will fight against coronavirus. But it will not tell you if you are infected right now. If you have symptoms right now and you want to know if you are infected right now, you need a diagnostic test, either a molecular test or an antigen test to see if you have the virus particles in your system right this moment. Within the diagnostic test category, there's a couple different methods that we can use. In healthcare, we always talk about the gold standard, and the gold standard is a PCR test. So it's looking for genetic material. It's the most involved process. It takes the most reagent or chemicals we use in the lab. It takes trained personnel and specialized equipment, but it's also the most accurate test, which is why it's called the gold standard. But this is not really going to be used for widespread testing. And what I mean by widespread testing is we want to test everybody who's going to work, going to school at regular intervals. So we can test someone if they're having symptoms, but if we want to do testing on a population level with asymptomatic people, a PCR is not going to do it for us. Another testing method that's really interesting that companies are working on is called a lateral flow test. And we are already aware of what a lateral flow test is. It's the at-home pregnancy test where you put a couple drops into the testing kit and it gets absorbed up the strip and it will give you a visual readout of your testing results. So 2 lines you're pregnant and 1 you're not, right? So in this case, 2 lines you have COVID and 1 line you don't. And so there's a new test coming out from Abbott called Binax Now, which has that, and that's going to be coming out by October. They're going to be shipping out like 5 million tests, so that will be really interesting to see how that is used. Another really interesting method that was developed recently is called Crispr. It's a gene editing tool, so that was developed to detect gene mutations, and it's like genetic scissors. It actually cuts out the genetic mutation, puts the two pieces together, and you have a normal gene again. So that's really amazing that we can do that nowadays. So now there's 2 companies using that CRISPR method to develop a COVID detection test, and those will both be rapid point-of-care tests, as with the lateral flow. So a rapid point-of-care, so a point-of-care means you're getting it at the place where you are receiving care, meaning at your doctor's office, at a testing center, in a hospital. So these tests will be done within 5 to 20 minutes, and that will be really great for widespread testing. Another testing method is called loop-mediated isothermal amplification. I have to say that slowly. So loop meaning it actually goes in a cycle through these test tubes to amplify the genetic material so then it has enough to be detected. And so this test method is really interesting because you can do it just with some test tubes. It doesn't take a lot of specialized equipment. And because it doesn't take specialized equipment in a specialized lab, you can actually do testing in remote areas. So that's pretty amazing too. So again, there's a lot of companies out there that are working on this around the clock. There's going to be a lot new tests coming up, and so I will do my best to keep you as updated as possible. I have a lot of information coming out for you, so please subscribe again so you don't miss any of this information. If you have any questions, please put that in the comment box below. I'm always happy to answer any questions that you have. I'm Dr. Rachel Johns, and I'm here to help you control your medical problems so that they don't control you.